So, good morning to all. For recap, in the last lecture we had behavioral learning theories in which we had learned about the connectionist, operant conditioning, and Pavlovian classical conditioning. Today we are going to discuss about cognitive learning theory. So we know about the what the behavior is, and cognition is a technical term. First, we got to know what is the cognition and what are the technicalities remains around it. To start with, what is cognition? Cognition is a mental processes to absorb and retain information through experiences, through senses. We have five sense organ like eye, ear, nose, tongue, and skin. And thought is known as cognition. What are cognitive functions? By virtue of this cognitive ability, we have certain kind of functions which can be attention, pattern recognition, problem solving, memory, learning, decision making in a situation, language processing, perception, imagination, logic and logical and strategic thinking are governed by these cognitive processes known as cognitive functions. The process refers to mental activities that enable us to engage with our environment and make sense of our experiences. So this is bidirectional communication between the environment and the person, cognition of the person, by virtue of which they make out certain thought process and behave in accordance with that. Cognition, a term that refers to thoughts, are frequently perceived as primarily verbal in nature. What we used to speak is our reflection of thinking process. But there are other terms also like auditory imagery, like talking to self within your mind, or talking to yourself with your own imaginary world. So auditory imagery is also the part. Visual imagery, mental images you make because of some thought. Kinesthetic imagery, mentally experienced bodily sensations. The sensations are experienced mentally, but actually these are not there. It is important to note that term cognition with an S generally pertains to thoughts, while cognitive processes, functions, or abilities refers to the various other processes which is outlined below in next slide. So the functions, processes, abilities and related concepts are, we are not going into detail of each terminology, but which is not very common, we will discuss in short. The terms related to these functions, processes, abilities and related concepts are sensation, perception, learning, memory. These are the obvious things, and one is gnosis. Gnosis is ability to recognize things you have already learned via senses. Yeah. Like people, car, food, any kind of object. Praxis is ability to move your body in meaningful and goal directed ways. Praxis, I think you must know because of the mechanics of musculoskeletal system. You must know about the praxis. है ना? Like eco praxis. Thinking, processing speed, and priming. Priming is the influence of something on the future cognition. So attention and salience. Salience is ability to focus and make something more pronounced through words, attention and memories. Obviously observation, vigilance, awareness, heuristics like learning moves in the chess, like predicting the further moves after the one such of cognitive learning. What the future moves will you take or what will happen in near future. Biases, perspectives and mental rotation. creative cognitions, spontaneous cognitions, social cognition, auditory cognitions, visual cognition, and metacognition. Okay, these are the words related to cognitive functions, process, abilities, and related outcome, related concepts. Now we will learn three things in cognitive theories of learning. The one is cognitive learning theory, cognitive behavioral theory. There are two theories. One is learning theory, one is behavioral theory. The third one is cognitive behavior therapy. So what is cognitive learning theory? In 1930s, Swiss psychologist Jean Piaget established cognitive psychology as a different approach from behavioral psychology. So behavioral learning came first, then the cognitive learning came into picture after Jean Piaget. He introduced the concept of schemas, which are units of learning that develop throughout the person's life, forming their unique way of understanding the world. Cognitive learning theory focuses on how our brains take in, store, and use information. So this is the cycle. What you see, what your brain takes in as a uh, as an auditory stimuli, as an visual stimuli, or other kind of stimuli, and store that information and apply in the newer feature. The cognitive learning theory involves metacognition. Metacognition means thinking about thinking. It has three components. One is comprehension, second is memory, and third is application. Comprehension means understanding what is happening around, memorizing those happenings, and applying these new knowledge in everyday situations, such as through hands-on activities, writing, discussing topics, and other aspects of your day-to-day life. The process of application of knowledge enhances understanding as fresh information and experience is coming, and creating a continuous cycle can be considered as loop of learning. This happens inside the mind, but they are influenced what we sense from the outside world. So this is again bidirectional communication between the environment and cognition of the person. Now examples of cognitive learning. One is experiential learning. This we will take in the fourth lecture for learning theories. And in short, the experiential learning is practicality. What what the practicality teaches a person a lot better than learning from traditional literature. So practical, the much you do the practical, you learn more by yourself and gains valuable experience in return. So this is learning by doing. More and more you practice, you will gain more and more knowledge. Through the cognitive technique of experiential learning, you can draw important lesson about life from other people and experience from yourself. So this experiential learning is the learning from your own experiences and the experiences of other. No. What you experience in your life uh, maybe a kind of slow learning in this context, but when you learn from the others experience who have robust experience of his life like 20 years 40 years, then you can gather more information in shorter period of time. So it enhances your ability to evaluate and think critically about your experience as well as your ability to connect it with earlier experiences. Another term is recall. Active recall is a great way to improve long-term memory. Instead of just reading or rereading the notes, when you repeat the things in your mind, it will help you retain the more and learn more about the topic. By trying to remember information without looking it up, then they strengthen the brain connection related to that memory. When you repeatedly recall the subject or recall the topic or recall your behavioral experiences in your life, it makes more connections in your brain, which enhances the learning. Another is explicit and implicit learning. What is explicit learning? When a person actively looks for knowledge from external source, there is active participation of the person. This is the most typical form of learning, requiring a conscious effort to gain new information and skill through organized methods like this formal class, formal education, reading text, reading magazines and other material, attending class and participating in training session. So this is actively learning. You want to learn something from these methods. In implicit learning, what happens is it is an automatic process where you don't realize that you are learning until you find out later that you have remembered something. Yes. For example, when a child learned how to talk, when he started walking first time, eating and typing without need to look at the keyboard is kind of implicit learning when the person gets to know about it later on. Simulation. Nowadays, simulation is more into the picture in learning methods in everywhere in colleges, universities, and institutions. We all already have the simulation lab in the medical college also. One fine example is of training of jet pilots in simulated environment or training of train drivers, loco pilots in simulated environment. Simulation is also a kind of cognitive learning. Creativity, obviously, creating things by virtue of your own knowledge and try to invent new things. What are the benefits of cognitive learning? It improves problem solving ability, helps individual to learn new concepts at a faster pace, develops a deeper understanding of newer concepts. It helps individual boost their confidence, equipping them to handle complex tasks and situations. Individual can learn to develop their creative thinking skills through cognitive learning, which promotes innovation. Now, what is cognitive behavioral theory? We have talked about the cognitive learning theory. What is cognitive behavioral theory? So, behavioral theory comes into picture beforehand the cognitive theories. Now, the behavioral theory and cognitive theories are combined together, is known as cognitive behavior theory. So, this theory leads to the well-known therapy, cognitive behavior therapy. You must maybe know about this in a shorter form called as CBT, and it was created in 1960s by Dr. Aaron T. Beck. This theory suggested that our thoughts and feelings are closely connected to our behaviors. So, in simpler means, the cognition and behavior do not act independently uh, while they are connected to each other actually. The feedback loop here is one of the external stimuli affecting bodily and mental sensation, in which turn affect behavior. So, what is going in the mind of a person can affect his behavior or vice versa. Behavior of the person or behavior in the environment can change the thought process of that person in a positive way or in the negative way. So, as a therapist, we will talk about the uh, abnormal thinking process and the consequence of it and how to correct by virtue of cognitive behavior therapy. So this is the pictorial representation of the loop. There is a thought which may lead to a certain kind of behavior, and this behavior can lead to a emotion like anxiety and depression. The cycle can be start from anywhere from emotion, behavior and thinking, and may go into any direction. So main idea of this theory is wrong thinking leads to emotional pain, and this make people disconnected from reality, and causing them to suffer mentally from their own made up maladaptive thinking process, or can be considered as lying to themselves. This is again the pictorial presentation. You can see in the top of the picture there is a situation. For example, a person is criticized at work. Then a thought comes in his mind, I am not good enough, and that leads to an emotion that I am worthless, or patient may feel anxious, may feel anxiety, and this lead to a behavior. He started avoiding contact with others, and the physical reaction was he feeling tired. There will be loss of appetite, and this cycle continues. Then again, this automatic negative thought strengthen, and the vicious cycles goes on. We will also learn by the examples in next few slides. Yeah. So keep in mind there is a situation which provokes a thought which is negative, and that leads to a emotion of anxiety and to the avoidant behavior, and this avoidant behavior is uh, now converted into tiredness and loss of appetite as physical symptoms. This is the Aaron T. Beck's cognitive triad for depression. So, because of the certain situation, the person started thinking negative view about the present. The things are not good. The present is not so enjoyable. Then the person started viewing the negative view of the future, and this negative view of future leads to negative view about oneself. So there are three things: the present, the future, and oneself. This is the cognitive triad of depression of Dr. Aaron T. Beck. The fundamentals of Dr. Aaron T. Beck outlined in three levels of cognition. One is there is a core belief you can say, thought of that cycle. Core belief, also known as schemas, are strong beliefs about ourselves, अपने बारे में, the other people, दूसरों के बारे में, and the world around us. These beliefs are usually formed early in life. For example, about the self, the person may start thinking, I am useless. For others, the world is unfair, and the future, things will never work out for me. So, I am useless is psychopathology can be converted, can be considered as worthlessness. The world is unfair. This may be converted into helplessness as a feature of depression, you must know. And the things will never work out for me. The pessimistic view of future, which is also one of the part of depressive criterias. So, after belief, core belief, there is dysfunctional assumptions. Out of that belief, what the person starts thinking, dysfunctional assumptions are strict conditional rules that people follow in their lives. These rules can be unrealistic and harmful. For example, someone might believe that it's better not to attempt something than to risk failing. This is in the another context. If there is fear of failing in a task, the consequences, do not attempt that task. So this is kind of a negative thought process. We had talked about the negative automatic thoughts. So negative automatic thoughts are thoughts that come up without effort in a specific situation. So these are automatically comes into the mind when a person land up in a situation. For example, in depression, these thoughts usually focus on negative feelings like low self-worth and feeling worthless. For example, when confronted with a task, if a task is given to the person, a negative automatic thought might be, I will fail. In anxiety disorders, automatic thoughts often involve thinking the risks are much higher than they are and doubts one's ability to handle the challenges. For example, in the social anxiety disorder, so they may thinking of non-performing adequately in the social situation, the person may feel anxious because of the automatic thought of I will fail or I will not perform. So this is real life example of cognitive theory. The example one is character is Rajesh was a passionate runner. On the day of event, as the race progressed, he began to experience discomfort in his knee. He ultimately found it necessary to cease running entirely. There was an event, there was a situation. So the situation is the Rajesh failed to complete the race. Now he began to believe that he was not an effective runner, that his training effort had been in vain. Whatever the training he took is not adequate, that he would never reach his objective of finishing marathon. So these are the negative thoughts leads to decreased confidence and discouragement. So this is uh, uh, the situation leads to the thought, and thought leads to the behavior, which is he stopped running altogether or practicing altogether regarding the marathon. So in another example, Sarah is preparing for presentation at work and is feeling anxious. She is having following negative thoughts. The thought is I am going to mess up and embarrass myself. स्टेज पर जाएंगे कुछ बोलेंगे सब कुछ गड़बड़ हो जाएगा एंड आई हैव टू फील ashamed of that non performance. The feeling will be she become nervous and self conscious. The behavior will be procrastinating in preparing for presentation or totally avoiding, try to avoiding the presentation, giving the presentation. So we have understood what is cognitive triad, what is cognitive theory, and what is how the cognitive and behavior are interrelated with each other and leads to various negative automatic thoughts and can lead to impairment and distress in the life of the person. Now what we can do is we can do the CBT. We have to we have to so let's understand about the cognitive behavior therapy, how it works. Basically, CBT focuses on teaching. CBT does not suggest anything to the person. It focuses on teaching, and patient has to become their own therapist. The therapist just only give the guidance, and what the person has to do by on his own. Certain kind of tasks, certain kind of exercises or certain kind of surveys may be given to the person to conclude that whether the things are right or wrong. Whatever he is thinking is right, the negative automatic thoughts are right or wrong. It helps them understand their current thoughts and actions and provide tools to change unhelpful thinking and behavior pattern. How it will work, we will discuss in next slides. It focuses on solving the current problems, and certain goals are set to reverse the vicious cycle of negative automatic thoughts and behavior and their consequences. In cognitive behavior therapy, the goals which have to be given to the person should be smart. Smart means the goal should be specific, the goal can be measured, the goal can be achieved, the goal should be realistic and time bound. For example, a goal for someone with obsessive compulsive disorder. Do you know about the OCD? Obsessive compulsive disorder might be to cut down hand washing from 5 hours a day to 1 hour a day within 3 weeks of therapy. So this is one of the goal which is specific, which is measurable, can be achieved within 3 weeks and is realistic and time bound. This is in the context of obsessive compulsive disorder and can be used in various other psychiatric disorder and psychological problems. So in CBT, first is to target the maladaptive core belief. One is to target the maladaptive, the negative view of himself or environment is to be targeted. Thought records are used to make a patient aware of their NATs. The person has to make a record of the thoughts, and the therapist want to find out the negative automatic thoughts and can be taught to the person what is happening. Behavioral experiments are mainly used with anxiety based mental health disorders. What is behavior? The behavior is usually avoidant behavior or anxious behavior. So behavioral method, for example, if the person is fearing of height, that person in a graded manner can be exposed to the height, so the person anxiety gradually goes down. For example, if the person is having fear of height, the person can be taken to second floor, then to the fourth floor, then to the sixth floor, observing that at each and every step the anxiety of the person is normalizing. Then one have to move to the next step. This may also be helpful in the case of athletes and sports. Now remember the case of Rajesh, an marathon athlete. So therapist has had set a realistic goal for him. The Rajesh Mark set new, more achievable goal for himself. He started celebrating small wins, engaged in positive self-talk, joined a running group, and tracked his progress by monitoring or by technical means also. So what happens is in new thought, with this consistent effort, he started thinking I can improve my running and achieve my goals. New feeling is optimistic and motivated. New behavior is Mark starts incorporating interval training into his runs and sets a new goal of running a mini marathon in few months. Despite of going to a full marathon, he thought that I will first go for a mini marathon. So in this graded manner, his anxiety reduced, his avoidant behavior is vanished, and he started taking participation in improving himself for full marathon. In the second example of Sarah, after practicing relaxation techniques and challenging her negative thoughts, she starts to think more positively. What the thought had been changed, that I have prepared well and known my material by doing good exercise, by knowing the basic knowledge of that presentation and studying hard and doing practice and rehearsals. Now she started thinking I can do this. The feeling is she is confident and calm. The behavior is practices the presentation and delivers it successfully. Okay, how this cognitive behavior therapy works for maladaptive behavior and thought process. So, what is the scope of this CBT? This CBT can be used in various psychiatric disorders like depression, The recommendations are for mild to moderate, it can be used loan therapy, and moderate to severe, it can be combined with antidepressant medication, and it can be used for relapse prevention also. It can be used in generalized anxiety disorder. You know all about generalized anxiety disorder. The class must be done for anxiety disorders in the previous lectures. No, I will tell you later. Panic disorder. No, obsessive compulsive disorder. You all know. You know about the post-traumatic stress disorder. Yes. Yeah. So all cases, including mild to moderate cases, are the target of CBT and can be benefited by this therapy. In summary, the cognitive model suggests that how people feel and act is shaped by the apperception. Apperception means their own perception of the situation, how they treated this situation, how he or she looked upon that situation. For example, in the case of Rajesh and Sarah, they looked the situation in a negative way. But therapists of these two are positive. He looked in another way. So cognition has three levels. It has core beliefs, dysfunctional assumptions, and negative automatic thoughts. Formulation fits a person experience into cognitive behavioral framework. One have to fit this experience into cognitive behavioral framework. And the CBT is focused, time limited, and involves teamwork to accomplish the task. CBT uses cognitive method like guided discovery, Socratic questioning, along with the behavioral method like activity, scheduling, and experiments are given to the person. It is case to case dependent. For example, in panic disorder, what the notion is, in a panic disorder, the attack is mimicking like a myocardial infarction or heart attack, but it is not heart attack. So that person can be given task to see the prevalence of that disease, what are the factors which can lead to this thing, and how many attacks can how many myocardial infarction attack one can have in his life, because in panic disorder there are many attacks of this kind in this in their life, and they think that these are because of the cardiac issues. But what is the general consensus of one person, how many attacks can he have? Three, you know. So this is how their thinking is changed, by experimenting, by explaining, by giving tasks. Many studies shows that CBT is effective for various mental health issues, as we have already discussed, from depression to PTSD. It is helpful. Now, thank you.